everybody. This is Jeopardy! With your host, Tessa Fowler. Starring the one and only Alicia Eastwood. Directed and edited by Nick Glass.
Okay, team names. What's your team name?
The Endocrines.
Endocrines. Team name?
H. pylori.
We'll go H. pylori first.
Okay.
Go ahead and choose.
I'll take
Category.
complications for 100.
Okay. Most common complication of peptic ulcer disease, it's seen in 15% of the patients. Nick, endocrines.
Hemorrhage.
Good job. Yep. Okay, your turn.
I'll take risk prevention for 100. Please.
Okay. What age group is at most risk for developing peptic ulcer disease? Yes. H.
Elderly.
pylori. Yes, you're correct. Tied 1-1.
Okay, I'll take diagnostics for 300.
Okay. This medication, you have to instruct the patient to stop using 2 weeks before the urea breath test or the stool test. Yes?
PPIs.
Good job! There we go. 2-1. H. pyloris?
All right, so we'll take complications for 200.
Okay. This cancer is most closely related to the complications of peptic ulcer disease. Yes.
Gastric cancers.
You are correct.
I'll take risk and prevention for 200.
Okay. What foods should you avoid to decrease your risk? Oh, yes, and
You're going to want to do spicy, high-fat, and acidic foods.
that is correct. Good job. Okay. Tied again, 3-3. Go ahead.
All right, I will take diagnostics for 500.
Oh boy, okay. Let's see. All right, this test has a sensitivity rate of 97%.
Beat me.
You beat him.
Endoscopic surgery?
No, that's not it.
Oh.
Can you answer it for her?
Use a breath test.
Oh, the urea breath test?
Yes.
Okay. That is correct. Good job. Alrighty. Now you're leading the pack.
All right, I'll take treatments for 300.
Okay. What is the average length of treatment time? Endocrines.
10 to 14 days.
You are correct. Good job. Pulling ahead.
So, treatments for 400.
Okay. This medication protects the lining of the stomach and the small intestine. H. pylori.
Sucralfate.
Good job. You're getting better. Good job. Coming up behind endocrine.
2 hours later.
Oh my god, we're tired. Alright, last one. Who can get it? Diagnostics for 400. Alright, this is the test that cannot distinguish between active or past infection. Endocrines.
Serologic antibody test.
Yep, good job. Alright, endocrines, I think you took that one. Stay tuned for Final Jeopardy after this break. Peptic ulcer disease starts out by hypersecretion of HCl, which leads to erosion of the mucous membranes. That causes a diffusion of HCl into the stomach and blood vessels, which releases histamine and prostaglandins, overall creating an inflammatory response. So the histamines that are released vasodilate and stimulate the release of peptin and gastrin, which will then cause damage to the unprotected stomach lining. Okay, so there's two main types of ulcers. They are gastric ulcers and duodenal ulcers. They are named aptly for where they occur in the stomach. So we've got the duodenal ulcer, that is the most common. It's 4 times more common than the gastric ulcer. And it's usually found up by the pyloric sphincter. The gastric ulcer, less common, it is in the stomach. So the two main causes of peptic ulcer disease, H. pylori and NSAIDs. H. pylori is a bacteria, it's gram-negative, it's typically transmitted the fecal-oral route, and not everyone with this bacteria will develop peptic ulcer disease, but it does increase your risk quite significantly. H. pylori is responsible for 95% of these duodenal ulcers and 70% of the gastric ulcers. Having this H. pylori bacteria also increases your risk for MALT, which is a type of lymphoma, and gastric carcinoma. So just generally, this H. pylori will damage the protective lining in the stomach mucosa. So then we go over to NSAIDs, and they will irritate the epithelium in the stomach, and they will inflame the stomach lining, causing like a ruptured blood vessel and leading to this ulcer. And they slow the production of the protective mucosa. So to diagnose H. pylori, there are some general diagnostic steps. The most effective one is an endoscopy, but those are really only recommended for people that are over the age of 55 and have really high-risk symptoms, enough so that they decide that an endoscopy is preferred over the other diagnostic tests. The upper GI series test is when someone will drink a chalky liquid called barium. That's going to coat all of the organs in the stomach and allow for the doctor, the x-ray technician, to see it when they do an x-ray on the upper body. CT scan, also kind of similar, looking for that general ulcer. The remaining 4, the urea breath test, the stool test, the serologic antibody test, and the culture are all going to help diagnose the H. pylori. These 2 are very effective, however, they need to make sure that the patient is not currently using PPIs, and they should withhold them for 2 weeks before the test.
Okay, some signs and symptoms of peptic ulcer disease is the most common is stomach pain. People feel a burning sensation. It can radiate to your back, can radiate up to your esophagus. It seems to be worse, the pain after you eat meals, especially if you eat at night and then you lay down. Not all ulcers will turn into bleeding ulcers, but if they do, you would have a lot of nausea. You could vomit bloody secretions. Again, the abdominal radiating, the pain that you feel, the sensation of the burning can radiate to your back. A lot of people think that something's wrong with a different part of their body, such as kidneys. When it radiates up to your esophagus, people go to the ER thinking they're having a heart attack, when it's all from this wonderful ulcer disease. Sometimes the skin will get a little pale, and you would have some bloating or burping, especially if you have the H. pylori that's causing the ulcer. There is some treatments here. If you do have the H. pylori virus, you would be treated with antibiotics, and there's also the PPIs, the proton pump inhibitors, such as omeprazole, Prilosec, Nexium, those types of medications. Those can be over the counter or prescribed by a doctor. There's also the H2 receptor blockers, which is histamine 2s, Zantac. Those also can help reduce the acid and increase your pH to prevent ulcers from happening, especially if you are known to have them. Sucralfate is a medication that puts a lining that protects the stomach from food and other acid from continuing eroding it, which would lead to a bleeding ulcer or perforation. Antacids, such as Tums, you can buy over the counter. They help to neutralize the acid. That is more of a short term, kind of reacts fast, helps you get the relief, but doesn't last that long. You can buy those over the counters, and all these other 4, you would need a prescription, or these 2, you could buy over the counter plus have a prescription.
All right, so for peptic ulcer disease, we're going to talk about the impact that it has on the different organs. So for the heart, there were some recent studies that showed that peptic ulcer disease and heart-related diseases have a lot in common. With peptic ulcer disease, obviously it's going to cause a lot of pain, which could make a sympathetic response, increasing heart-related problems. So a recent study showed that after eliminating the peptic ulcer disease, actually angina symptoms go down. As far as the kidneys go, chronic kidney disease increases the risk of bleeding, which will then increase the risk of mortality. When it comes to the liver, your ulcer can actually extend into your liver, which then can cause damage. So pre-existing liver disease increases the risk of ED as well. For GI, so you can have obstructions from a narrow duodenum from an inflammation. You can have perforations, which is like peritonitis or risk of release of contents in the peritoneal cavity, or obviously there's gastric cancer as well. For the impact on the lungs, COPD increases peptic ulcer bleeding, so that increases the risk for aspiration. Smoking also increases the risk, and obviously you can have difficulty breathing from the pain.
Previously on Gloved and Loaded.
Knock knock. Hey, how are ya?
Oh, I'm not doing very good.
Okay, well my name's Alicia, and the provider would like me to do a focus assessment on you. Is that okay with you?
Yeah, that sounds
All
good.
right, can you give me your name and date of birth?
My name's Tessa Fowler. I was born 10/10/1994.
Oh, wonderful. Okay, well I'm gonna get all my stuff here. I've heard that you've had some stomach problems. I'm gonna do a few assessments and we'll go over some things, okay?
Okay, sounds good.
All right. Okay, Tessa, I got everything I need to do the assessment here. So let me just get my gloves on. Are you comfortable the way you are? Because I'm going to probably lay you back a little bit. Is that okay?
That's fine. My stomach just is killing me right now.
Okay.
It hurts so
Does
bad.
it hurt when I lay you down?
Yeah, but everything hurts.
So I was wondering if you're having any bloating.
Oh yeah, absolutely.
Okay.
Big bloating.
Big bloating. Okay.
Yeah,
Ask-
actually I was I threw up the other day. And,
Oh, okay. Was there any blood in that?
I don't know. It looks kind of like coffee. And
Like
I don't know
coffee,
if that-
okay?
is
Like
that-
the grounds of
Yeah,
coffee? Okay.
yeah.
How about your bowels? Have you been having any weird colored
Yeah,
stool?
they were kind of dark.
Okay.
Yeah. Does that
Like-
mean blood?
Well, it could be.
Okay.
So we'll definitely let the provider know about
Okay.
that.
Okay.
Okay, and when did this all first start?
Oh, it's been a while, 2 weeks maybe.
Okay. All right. And the symptoms, are they continuously, or are they worse in the morning or at night?
It's definitely worse at night. I feel like it helps when I eat.
Okay.
Every time I eat, I feel a little bit better. But then once I have these times in the midday where I don't eat, then I'm starting to get those pains again.
Okay.
So it really comes and goes.
And how bad would you say when the pain's at its worst? How bad is that on a scale from 0 being nothing, and 10 being the worst pain you've ever felt?
It's probably a 7.
Okay.
Yeah.
And do you take anything to relieve this?
No, I
Pain?
was taking some aspirin, and that
Okay.
really wasn't doing anything.
Okay.
So I haven't really done much except for that.
Okay, so you're not taking any type of NSAID, ibuprofen, or oxycodone, or
Just the
Vicodin?
aspirin, yeah.
Just the aspirin. Okay. And how often when you're vomiting, are you seeing the red colored stuff?
I just vomited the one time, and I saw it that
Just the one time. Okay.
Okay.
If anything hurts, you let me know and I'll stop, okay? lot of good sounds in there. I'm just gonna feel around now. Now, if anything hurts you, I'll stop there and you tell me where it's at, okay?
I've got a little bit of pain up there.
Right there, okay. Right upper quadrant pain. Okay, how
Up
about
there? Yeah.
okay, and how about right here?
Nope, no pain there.
Okay, all right, we'll put that down here. All right. Okay, Tessa, so I listened to your belly. I was wondering if you could pull down your mask and open your mouth for me. I'm just looking to make sure there's no bleeding and that your gums are good color. Anything hurt in there? Open up?
No.
Okay, your teeth and gum look great, so that's wonderful. And then I'm going to give you your call light here. So, but we'll be right back. Doctor will be in just a minute, okay?
Sounds good.
All right.